So, talked about aging. We all are going through it. We can't stop it. But what are some of the things that affect our aging? Well, first, our genetics. You always hear about stories of family members that lived well into their 90s and 100s, and there's such a strong genetic predisposition to longevity. But one of the biggest factors is our environment as well that we have around us. It might be the environment of where we're living. Are we close to different areas where there's, radiation and chemicals and stuff like that? That affects our aging. But number one is really lifestyle as well. And when you looked at the different primary care medical disease spectrums that can be treated in modern day medicine today, we always think of genetics and environment, but our lifestyle predicts our health well over 50 to 60% of the time. And when we talk about lifestyle, we're talking about proper sleep, proper nutrition, proper activity, proper social engagements, reductions of smoking if you smoke, reductions of alcohol if you use too much alcohol, etc. A healthy lifestyle choice helps maintain the healthy body and the healthy brain. So it's very, very linked. But we will find that as we age, we might find difficulty finding those words. And I've noticed I do that. I know that word is on the tip of my tongue, and my brain is cataloging, and it's going through, and eventually it finds it. But we find that as every decade that we go through, it might be even slower to do all that cataloging, etc. I might have problems with multitasking. And I always used to joke with my wife that women are much better multitaskers than men. I still believe that. But the studies have shown that human beings in general, it's very difficult to multitask. That we might do some of it in certain degrees, but usually for our full concentration to be given, it's usually one task at a time. So as we age, though, we find there's more problems with trying to do that multitasking. For example, I was reading a book, but then something flashed into my brain that I had to go get something from the garage. So I start walking towards the garage, and then I open up the door, and then I'm in there, and what was it, right? We've all been there, yeah. Yeah. So there's also decreases in the ability to pay attention, meaning we're listening to a person, but our brain is starting to wander and start thinking of other things, and we need to kind of get that brain back into the focus of the attention. But the really good news is we can still learn new things. We always are creating new memories, and we can improve vocabulary and language skills. There's a lot of people that after retirement decide to pick up a brand new language. They always wanted to learn French and never had the ability to do it, and now they're starting to learn it. And there was something in the American Medical Association Wire just this morning that I was reading called about neurogenesis. Meaning, well after the age of 70, our brain is still producing brand new neurons in the brain. We used to think that we maybe had finite neurons and that's all we had. And it's really important to go through the aging spectrum, building up your resources as high as possible. But the good news is we are still developing brand new nerve cells every day. Yes, I agree. So what are some of the threats, though, or risks that we might have to brain health? Some medications can actually slow down our brain thinking. They might have a risk. Even though they're helpful for one type of disease state, they might be impacting our cognitive state, our brain thinking. Smoking. We know that smoking affects the arteries and the amount of artery flow of blood. And so with long-term smoking, we actually can reduce the amount of blood flow that's going to our brain through our cerebral arteries here, going up our neck and into the brain and recirculating around. Excessive use of alcohol. A lot of studies have shown that from a health perspective, maybe there's some heart health benefits with having a glass of wine a day, 2 maximum, but that the negative effects of having alcohol start to increase if we're regular users of 3 drinks and upward. And the reason for that is it really starts to affect our cognitive brain. So just look back at any experiences you may have had. If you had too much one night and then the next morning you're walking around in a fog, that's that cognitive effect of alcohol afterwards. And with long-term use, that fog doesn't seem to lift as readily, as quickly. as it once did. Heart disease, diabetes, and other health problems. Heart disease and diabetes are linked together because diabetes is really a disease state of the blood vessels. We think of it as something that just has high blood sugar, and it does. But too much high blood sugar and all these hormonal imbalances that occur because of it really affects the heart and the blood vessels. And again, we need that positive blood flow going to our brain as much as possible. Poor diet, insufficient sleep, the lack of physical activity. So the key is you keep moving your body each and every day. And if you can't move your lower legs as well because something is hurting, armchair aerobics, getting those arms moving, getting a set of small weights that you can do armchair aerobics and keep your brain pumping, keep your body active. And then social isolation is really, really important as a risk to brain health. We are human beings. We are meant to be social with other human beings. We are not meant to live in a vacuum. But what happens as we age, our friends might be passing away, our spouses might be passing away, our family members may have moved to other areas of the country. And it's really, really important to keep engagement in meeting new people if you've had people move away from your current residence. And making those social interactions as high as possible. That is almost key now with depression and with mood, is the lack of social isolation that some people are having. Medicines, I talked about that already, that many of them or combinations can affect the thinking and the way the brain works. I really want you to ensure you have a good discussion with your primary care provider if you are wondering if your medications are actually a cause of some of the cognitive, the brain thinking that you might be undergoing. One that comes to mind, beta blockers are a really good medication for heart, and many people are on them after a heart attack because they help with changing the remodeling of the heart. They're also a blood pressure medication. But there are some people that find that they just can't lift through this fog when they're on a beta blocker. It doesn't mean everybody has that, but if you are on certain medications, we really want you to have this discussion with your doctor. Two that come to mind that are really, really important to have a discussion with your doctor are narcotic medications like hydrocodone or codeine. They really can produce a fog in some people. And also a class of medications called benzodiazepines. Some people may have used them short-term, Xanax, alprazolam, Valium, diazepam, and they can be used very effectively for short-term anxiety over a couple of weeks period. But the effectiveness of using them for anxiety decreases dramatically after a few weeks, and people get left over with the fog effects of benzodiazepines. And there's a dangerous combination of benzodiazepines and codeine or narcotics together, where it actually slows down the breathing from the brain center. And if you've heard that we've had a lot of discussions nationally about the risks of narcotic medications, pain medications, that's exactly why people are dying. They're not dying from a heart attack. They're dying because they're taking these medications, and they've been on them for years, but the brain is getting used to them and the brain is forgetting to keep breathing. So people will go to sleep and just not wake up. And so if you might be on these two medications together as a combination, please reach out to your primary care physician or provider and have a discussion. I'd be happy at the end of the talk today to stay behind if people had any other questions about that. Smoking and brain health. The benefits of quitting smoking at any age. If you're a current smoker today, there is still benefit for you to be a non-smoker tomorrow and the day after. But we know that there's a lower risk of heart attacks, a lower risk of stroke, and the thing we also always think about with smoking is lung cancer. Well, what is more common than lung cancer? Is there something we need to do for the screen? It may have gone to sleep.
Need the tech guys here. We keep on losing power.
Okay. So for those that may not have heard that, they're losing some power. We're going to have the tech guys come back, make sure we get the screens going. I'll keep on going and talking, so at least you can listen to me, and we'll get through the program. But when we think about smoking and lung disease, we think first and foremost about lung cancer. But the thing that's actually more prevalent in the community is chronic obstructive pulmonary disease, or chronic bronchitis, chronic emphysema. And we can still improve those outcomes in those diseases if people quit smoking at any age. We stop the breakdown of the lung tissue that's been occurring. It's hard to build it back, but at least we stop the breakdown that's occurring. With the decrease in smoking as well, we get better blood circulation, and that helps our brains. And then there are a lot of risks with secondhand smoke. Alcohol's effect on the brain. I already talked about this a little bit, but some of the things we see is definitely poor driving skills, and we should never drive if we've had a drink. But slurred speech, fuzzy memory, drowsiness, dizziness. One of the things that concerns me as a family doctor with the drowsiness and dizziness is risk of falls. So you're getting up to go to the restroom in the middle of the night, you might be drowsy, dizzy, you have a fall, you fracture a hip. One of the things we worry about with hip fractures is people are more prone to having adverse outcomes after that fracture, meaning they may be more bedridden. And if you're more bedridden, you have more risk of clots that could occur in the lower legs. Those clots could travel up towards the heart, towards the lungs, towards the brain. So trying to prevent that hip fracture in the very first place is really, really important. But I talked about the long-term changes to alcohol, our balance, memory, our ability to control our emotions. If you've ever known of somebody that had too much alcohol one day and then had nothing the next day or the day after that, they may come across as very argumentative and almost mean. And it's actually their emotional state is going through withdrawal as well. Body temperature is another thing that can change with alcohol's effect. And then there's medications that can be dangerous if they're mixed with alcohol. These are the common conditions that all can affect brain health. Talked about heart disease and high blood pressure already, but diabetes can do that as well, not only because of high blood sugar, but because its effects on the heart arteries and the brain arteries. Alzheimer's disease is something that is always on people's minds. There's more and more research that's going into Alzheimer's and trying to do scanning to see of who may be at risk and looking at the different types of neuron changes in the brain. Stroke is definitely one of the areas we want to focus on in terms of prevention. And I wanted to talk a little bit about blood pressure, because high blood pressure, far and between, is a silent disease. Meaning you get one reading at the doctor's office, you might get another reading that's saying your blood pressure is increased. If you have high readings over a certain time period, they'll diagnose you with hypertension, high blood pressure, and recommend a blood pressure medication. But it's silent to us. We don't feel unwell if our blood pressure is high. If it gets too high, 180 over 140 and above, sometimes people start to have pressure feelings in the head. But most of the time, with blood pressures 150 to 160, many people feel fine. But we know that leaving it at that level, untreated for years, starts to put an effect not only in our heart, but the pressure of the arteries that are feeding our brain. And so there's new recommendations that have come out late last year that our blood pressure for most of us should try to be with well below 120 over 80. And we're trying to do a better job now of who has pre-hypertension and starting to do lifestyle modifications earlier with them. Now, there are a segment of us as we age that if our blood pressure is too low, then we're more at risk of having falls and stuff like that. And for those people, but they are a smaller contingency, those people do better with a slightly higher blood pressure because of that risk of every time they stand up, they're dropping. Heart disease and high blood pressure. We were talking about this. How do we reduce those risks? Well, controlling cholesterol, controlling high blood pressure is very important. But key, before we even look at medications or diet, exercise, exercise, exercise. Keeping your body moving, keeping your brain moving. There are a lot of healthy foods that can help with our heart. Heart-healthy foods, the healthy fats. For years, we were teaching the wrong things when we were saying low-fat diet for everybody. because that was actually incorrect. And the studies now are showing that fats are okay. In fact, we need certain types of fats to produce hormones in our body. But the heart-healthy fats we like to get people to utilize, avocado is a heart-healthy fat. It actually helps raise our good cholesterol while it's lowering our bad cholesterol. Different types of oils, olive oil. Heart-healthy fats are very, very important. Nuts and beans and legumes. There's a lot of things that we can do with incorporating healthy types of foods into our diet. One of the things that we should try to limit or decrease as much as possible is anything that might be fried or packaged or processed. Whenever we're eating processed types of foods, there's a lot of hydrogenated oils in that, and these are the types of things that can clog up our arteries at a quicker rate than our other types of heart-healthy fats. Talked about quitting smoking and the limiting use of alcohol, and then diabetes. Well, what does diabetes do? It increases that risk for stroke and heart attack. It increases the risk for memory problems and Alzheimer's. And we know that maintaining that healthy weight throughout physical activity and healthy eating can prevent or control diabetes. There's a new study now through the CDC, the Center for Disease Control, and the American Medical Association that is doing a diabetes prevention pilot. And they took a bunch of people that had pre-diabetes based on their hemoglobin A1C. They don't have diabetes yet. And they put them through a 12-week program where it was focused on moving your body, healthy lifestyle food choices, and they were actually able to prevent diabetes from coming on. So more and more, we're looking at that upstream prevention of what we can do with dietary and lifestyle medicine. Alzheimer's disease. So it's a buildup of different proteins that are seen as harmful in the brain. And this starts to clog up those brain cells and not make them as active and healthy as they once were. And it makes those connections between all of those healthy neurons or brain cells less active. We know that all of us, as we age, are going to become more prone to getting it, but does not mean that everybody gets Alzheimer's disease. It just means that it happens more frequently in our 70s and 80s versus our 20s and 30s. But there is a subpopulation of early onset Alzheimer's as well, where some people get it in their 40s and 50s. There might be a genetic predisposition in some families, and they're trying to study this, where you see clusters of Alzheimer's disease in families. And then head injuries. This is why we're focusing so much more on our young children growing up. Concussions. A buildup of concussions over years, they're thinking might be predisposing people to Alzheimer's disease later on. But other risks as well: heart disease, high blood pressure, the lack of physical activity, depression, and diabetes. It's multifactorial. It's not just one thing, but all of these issues can play a part towards Alzheimer's disease. There are some therapies that are used as treatments for Alzheimer's disease, but they really don't slow down the disease changes in the brain. They might make for a short-term period that cognitive thinking slightly better, but it doesn't change what's happening in those neurons, in those brain cells, and that plaque that's starting to build up between it. The approaches that show the most promise in reducing the risk of your cognitive decline or your brain function, but it still needs more testing, is exercise, healthy diet, controlling blood pressure, and brain training. So there's been some thoughts that people that are always active doing crossword puzzles, doing reading, doing something to keep stimulating your brain. Well, maybe that is helpful in the end, but we need more studies to actually show us if it is or not. Brain injury. As we age, our balance starts to go. We're more at risk of falling and other accidents that can cause a brain injury. So balance classes. I know at Oregon State University, there's different balance classes that they had been giving and studying to see what seems to make an improvement in people's balance. Weight training, very, very important for our bone mass and for our muscles. Fall prevention. So we have some handouts at the front. I think we had them today. We've had them at other lunch and learns. But there are different things that you can do in your home setting to reduce your fall risk. And as much as I like seeing those nice throw rugs all over the place, and they look really, really nice, they are a fall hazard, especially in the bedrooms to the bathrooms. People's feet get tumbled over onto the throw rugs, and then they have that fall. So home safety is very important. A review of medications and vision with your healthcare provider. That's one of the things that our visual acuity starts to go. When we were younger, in our 20s, we could wake up and in the middle of the night, you might still see exactly what's going on, even though things are dark in the room. Our ability to transition from light to dark changes as we age. So you'll wake up, you'll need to use the restroom, but your eyes really haven't adjusted yet to that completely dark room. So some people like to have a nightlight in the hallway on their way to the restroom, so that can help guide them. And then sleep. Sleep is a quandary because we know that we get less of it as we age, but it's still very, very important. So our sleep quantity starts to decrease, but we want our sleep quality to be as high as possible. And we'll talk about some things later with what we can do with sleep. Depression. This is something that increases as we age, and the sad thing about depression, if I can use that word, in elderly, is it often is hidden, and it's not recognized. There's a change in people's life that occurs, and family members will say, well, they're just reacting to the stress that was in their life, and sometimes we are not the best people to be upfront with our family members and say, you're really struggling right now with mood, or you've had a thought to take your life. That does happen actually at an increased rate. The people that are more at risk, believe it or not, are men who have lost a spouse, that are elderly, and they're actually more prone to having depression that will lead them towards a completed suicide. So depression, it's important to remember though, it's not a normal part of aging. Life changes as we age, but depression is a clinical diagnosis, and it can hit us at any part of our age spectrum. So it's really, really important. That's why a lot of primary care doctors are now screening each and every time when people are coming into their clinics. And people are probably wondering about, geez, I was in last week with my blood pressure check, and you're asking me about my depression again. It's because we really want to make sure we're screening out for it, and we feel that it is something that is hidden in the communities. But there are treatments, not only just medications, but first and foremost therapy. Cognitive behavioral therapy for depression can really do wonders. And so don't think that there's only medication management for depression. Sleep apnea. We wanted to touch on that a little bit because it's very important with how the amount of oxygen gets to our brain. But what can happen with sleep apnea is we have pauses in breathing while sleeping. So I'm going to raise my hand here, and if my wife was in the audience, she'd be nodding her head. But I guess I am a horrible snorer. And I didn't know this until she taped me with my snoring. And it was bad. My parents both snore, and I told my wife, I said, if I am ever snoring with like my parents are, please tell me. And she goes, you've arrived. You're already there. But I had to ask her to, okay, well, have you heard me stop breathing at any times when I'm snoring? Because very loud snoring can be an underlying cause or a reason of sleep apnea, and many people won't know it. So snoring is one thing, but ask your spouse or anybody else that might be hearing you snore if you've actually stopped breathing. And what it would be like, I'm going to do a demonstration for you. So I'm snoring, I'm going. So it's that pause. You stop breathing for a while, and then it kicks in again, and you have to get through this pause. That could be a underlying sign of sleep apnea. So if any of you have it, there's actually, through your primary care physicians, there's a questionnaire. It's called Stop Bang. And at another seminar that we did about sleep apnea in general, I talked about that. But many primary care physicians have this certain questionnaire to help rule out your risk for sleep apnea, and then can refer you on to sleep testing. So what can we all do, though? Why are we here? We want to protect the brain. We want to take care of our health overall. We want to eat the healthy foods. We're always wanting to learn new things and be active. And again, I can't underscore that connection with our community. We are meant to be community-minded and interact with people throughout the whole life spectrum. We want to make sure we get recommended health screenings. Through those screenings are blood pressure checks. We want to manage high blood pressure and diabetes and our cholesterol. Want to make sure we're having a regular oversee of our medications. Just because you are on a medication that was started one time of your life may not mean that it's still appropriate to keep staying on it. Sometimes those medications need to change, or they might need to be reduced, or they might be interacting and competing with another medication that you're taking. So having an overview with your primary care physician, and actually a lot of primary care clinics are now trying to integrate pharmacists into the primary care setting to help look at your overall medications and help you with that. We want to reduce the risks for brain injuries due to falls and other accidents. And if you are a smoker, I would love for you to talk with me about ways we can get you to be a non-smoker. These are the different things that are in your packets that are all about eating healthy. I won't go through all of them because I want to make sure we have time for our break coming up too. The movement, getting at least 150 minutes of exercise each week. Now, when we talk about exercise, many people are thinking, I don't have time to go to the gym. If you are doing things going to the gym, that's great, but exercise may be as simple as doing a stair climbing up and down your stairs. So let's say you have a flight of stairs, and you have 3 stairs with a handrail that you can go up. 1, 2, 3, down, 2, 3. 1, 2, 3, down, 2, 3. That movement, just going up and down 3 sets of stairs, you're not getting as winded going up the whole flight of stairs, but you're able to get the heart moving and your legs moving just for a short-term period. So breaking into small chunks of time, that activity that you can do. You might be watching one of your favorite TV shows, and I see you doing that with your feet, and that's awesome. She's moving her feet right now as we're having our discussion. But many people can do that while they're watching their favorite TV show, moving their arms, moving things over their head with a set of small weights, moving their feet back and forth. So breaking up into manageable pieces of time, that activity is really important. Keeping your mind active. We also already talked about some of these things, but reading, playing games, learning new things, taking or teaching a class. We're never too old to enroll in one of the community colleges or at Oregon State University and take a class in something you've always wanted to be part of. And then volunteering or socializing. We know that the staying of connected, people who have meaningful activities say they feel happier and healthier, and the rates of depression are actually lower in this population. But we also know that when you are socializing with people, it does reduce the risk for other health problems, including Alzheimer's dementia and other types of dementia. So getting involved in the senior center. Chintimini has a great area of resources for people here in Corvallis. Getting involved in different agencies area agencies, the Council of Governments has a lot of programs that are resources for people as we age. So what can we do today? Pick one small thing you might want to do to help your brain. It might be, well, maybe I'll consider smoking. Or maybe I'll consider adding in some avocado into my diet. Or maybe I will reconsider getting my blood pressure checked again. I know it's been high, and I didn't want to have it checked again because I just don't want to be on medications. Well, it doesn't mean medications all the time. It might be doing something else lifestyle related before we go on those medications. For more information, it's in your packets here. These are your local agencies for aging, aging and disability resources centers. There's websites there on eldercare.gov. The National Institute for Aging has a lot of information there on clinical recommendations. And then the CDC has different resources on aging as well.